Hello, I'm Dr. David Lawler, and I'm here in the treatment room of our office, and I'm going to guide you through the oral systemic balance, or OSB, treatment process with Luann, who has consented to have the video record of her treatment used as a demonstration. Luann was referred to our office by her physician and has already had her initial evaluation and consultation. She's here today to have an OSB orthotic placed over her lower teeth. We start the treatment process with her, as we always do, by reviewing the physical symptoms that she's now feeling. Literally every one of the symptoms that she's going to be mentioning gives us a clue about the function of her tongue and its relationship to the airway space directly behind it at the back of the throat. I'll interrupt periodically to make comments about certain things that she does or says that are relevant. If you take the time to watch this entire video, you'll see very clearly that dysfunction in this particular part of the body casts a very wide net, with symptoms extending far beyond the original source of the problem.
I'm having a lot of neck and shoulder pain. I'm having a lot more trouble sleeping. Makes it difficult. My days are difficult. Headaches. I'm having more headaches.
Now I'm going to interrupt for a moment to point out something that's important. You may not have noticed, but Luann just cleared her throat. Frequent clearing of the throat is something that's quite common in people with dysfunctional tongue mechanics. I'll talk more about this later, but first I'm going to replay this section just in case you missed it.
Difficult. My days are difficult. Headaches. I'm having more headaches. I'm noticing more problem swallowing. You know, I'm not sure if I was dismissing maybe some things before I talked to you, because I've noticed I do choke more than I thought I did. You know, since we had that discussion, because I remember you explained to me why that was all related and how surprised I was. Because I originally said I didn't choke that much. Well, I do. I even choke on my own spit sometimes. And I guess maybe I dismissed that as no big deal, and so it didn't stay in my memory. Mm-hmm. So I'm noticing things more, you know, than I did before. And like the choking is one of them. The swallowing, certain things, certain times when I swallow, I have to do that cough that we talked about, that you noted, after I took the water. I'm just really tired. I really am. I feel the pain here, down my neck, into my shoulder, and I especially feel it in this shoulder over here. Okay. But I feel it, my whole neck. I just feel like I almost need to brace my neck. I feel it right here in the jaw. I feel tightness. It's hard to describe it. It's fullness and tightness. I'd like to cough. It's like heavy. I would describe it as heavy, not pain, but heavy. I don't feel like I'm breathing deeply enough, you know, because I find myself every once in a while, and I think my husband probably even verify this, during the day I'll go, just because I feel like I need a really deep breath, and I consciously make myself do it because I feel like I just need to do that.
Breathe through your nose easily?
I do, but it's stopped up.
It's stopped up right now?
Yeah.
Okay.
I can breathe through there, but I'm doing a lot of breathing through my mouth. I think it's because I feel like it's stopped up and congested or something. This ear over here is giving me fits. I don't know what's going on with it. I feel like it's clogged up all the time or something, like I've got something in it, but there's nothing there.
Any thoughts about how that feels? Now, you've had a chance to start examining your swallow. I just noticed you just cleared your throat.
Yeah, I have to every time. It never fails. Like I said, I never noticed it before till I was in here with you.
I just gave Luann a sip of water because I wanted to know her opinion about how the process of swallowing felt. Most people who have a difficult time swallowing are really unaware that their swallow mechanics are a problem because they've got nothing else to compare with. But I'm asking her all these questions because I really want her to pay attention to how her swallowing feels. That's important right now because in just a moment we're going to be placing an OSB orthotic over her lower teeth to bring her tongue into a more mechanically efficient position. Let's just test this. Now tell me how that felt.
Different. Didn't have to cough. It just went smooth. It was just, I don't know, it's hard. It was really nice. It was a nice smooth transition right down my throat. It felt good. And I felt like I truly swallowed. You know, sometimes I feel like I have to do a double to make sure it's gone down. That went right down the first time I swallowed.
Now notice that immediately Luann notices that her swallowing is easier with the orthotic in her mouth. Now not every patient notices this, but in her case it was profound. You will see that her muscle tightness and pain will quickly start fading away as you watch the video clips taken from the remainder of this appointment. I want to point out that the video has been edited to show Luann's comments. What you don't see is me continually making adjustments on the orthotic throughout the appointment to gradually bring her tongue posture into a more ideal position.
Oh. I don't feel as tight. I think my breathing's a little deeper. Really do not feel as tight in my neck. Oh wow. This side's really... Oh. I don't feel heavy here. It's amazing. I feel so relaxed. I can't even hardly explain that. I just feel relaxed. Oh, this is easing up. That's easing up. Really so relaxed. I mean, I even feel completely like all the tension's gone out of this whole area. Just, I don't feel that, used to feel like a lump. And that's not there when I swallow or when I breathe.
I'm curious about your ear. What do you notice in your ear?
Well, it's not the stuff that it was. Yeah, it's much more open. I was aching right here a little bit when we came in. Ache, you know, real ache. I just felt there was some of the tension of my... That's gone. It's not there. I just noticed one more thing.
Yeah.
I'm not as congested in my nose. I don't feel as congested. I don't know if that makes sense or not.
Mm-hmm. Good job. Now, if there's anything that you notice with this out of your mouth, just let me
know. It's all... I'm getting my lump back. It's right there. And now we just stopped up again. Now breathing is deep again. All the tension's coming back in my neck.
Which do you like best? With it out or with it in?
I want it in. It's amazing the difference it feels. It's almost instantaneous. I feel no pain at all in here, and I'm used to feeling something. I feel like I could really take a deep breath now. Like I'm really, when I'm taking that deep breath, I'm truly taking a deep breath and I'm not fighting to get it in. It's freeing, I guess is the word I'm looking for. I feel freed. I feel it clear down. I feel it clear down into my arms and fingers. I can't use it, and I'm constantly doing this, you know, because I can't feel anything and I can't get to work, you know. And it's just like, it's just amazing. I don't feel that anymore. My nose is open. Isn't that funny? It just occurred to me. I do not feel that desire to clench. My teeth just clench real hard. I don't know if it makes sense or not, but I just almost feel like my scalp is relaxed. I don't think I've been this relaxed in my life.
At the end of this appointment, Luann was truly pain-free. However, by her 1-week follow-up appointment, while she was much more comfortable, some shoulder pain had returned. Further adjustments on the orthotic resulted in this residual pain melting away just like it did in the first appointment. In Luann's case, 2 more appointments were necessary to get complete resolution of her pain. The number of follow-up appointments necessary vary from patient to patient. It is important, though, to note that in her follow-up appointments, Luann did report some, but not complete, improvement in her sleep and in her daytime sleepiness and fatigue. While many patients get complete resolution of daytime sleepiness and fatigue with only a lower orthotic, for Luann, the lower orthotic was not enough to fully open up her airway during sleep while she was laying down and her muscles were more relaxed. To get further relief, Luann elected to have us use a second and special OSB sleep appliance made to further open up her airway during sleep. To see this process and to follow Luann's progress, watch the second phase of treatment video.